Thank you very much. Thank you, Godfred, for the kind words, and thank you all for inviting me. It's a great honor to be with Jean-François and the others in this panel. And yeah, I would like to start by saying that it has been an interesting journey this year and a half at Unitate, changing a little bit the way we are trying to position ourselves and to become more part of an integrated response, a response in which changing the reality is a huge challenge and requires ambitious agendas, as everybody said, in science, in political decision, and in global vision, like Dr. Delfrécy said. If you analyze, well, this is, yeah. If we see the different milestones that the global response set along the years, and we see the skepticism that we had in the 3x5 in 2003, in the 15x15 in 2011, looking now at the objective by 2020 with a double in numbers, increasing a twofold in the number of people on treatment in the next 3-4 years, we realize very quickly that, as other colleagues said, the issue of the funding is a very important one. We see that in the last 15 years, there was a threefold increase in the global health funding from the year 2000, 11 billion, to the year 2010, 33 billion. And we expect a plateau, as Michel was saying, in the next few years, if not a slight decrease in international funding. Comparing it with the gap we have for reaching the targets, we are facing a huge challenge, which is absolutely evident. Even if the funding in WHA, in HIV, observed an increase of 30 times in the amount of money that we are investing today, the future doesn't look very promising. We see the Global Fund struggling to get the 13 billion that we are trying to secure in the replenishment. We see less and less fiscal space for the ministers in the countries to secure funding, sustainable funding and predictable funding for their national programs. And it is evident that unpredictability in funding is a big problem and impedes generating dynamics of sustainability in the response. And that affects behaviors and dynamics that are sometimes difficult to manage when we don't see when the money will come to the response and how much it will be coming. So sustainable financing through innovative ways of getting money is absolutely essential. And Unitate is a good example of that. We have 60% of our funding coming from air ticket levies, from a micro-solidarity tax invented by the French and the Brazilians and the Norwegians and the Chileans and other countries, and it works. We have been securing our funding in the last 10 years through a dedicated source of funding that is absolutely secured and now serves to pay the contribution from France to the Global Fund, a big part of it, to Unitate, and to a big part of the Gavi's contribution. So why not insisting in these type of mechanisms that are dedicated, that do not get into the national budgets, so they are not to be used discretionary by politicians, but they become a state project as opposed of a government project. Of course, this is a complementary way of increasing the funding together with national funding and international budgetary funding as well. The other element, if we really want to reach the global targets, very ambitious ones, is innovation. Innovation in the way we practice and we put the response in movement, in prevention, in diagnostics, in treatment. More robust, more easy to use, simpler, more tolerable treatments, better diagnostics, self-testings, PrEP, different ways of tracking the disease. Of course, these are important, and actually the pipeline looks pretty good from the scientific point of view. But the problem is, once we have them, what do we do with them? How do we translate an invention, a great idea, the genius's work in the upstream, into a reality in the downstream? How do we get these ideas and great projects into innovation, actually? An idea without changing the reality is just an idea, is not innovation. And we have a long journey between the R&D phase of a great idea and a treatment or saving lives, in terms of availability, in terms of is it possible to be bought, price, IP, the quality. How do we constantly get the same quality for all these new innovations? How do we forecast the need for encouraging the producers to actually do it? How do we secure the supply and the delivery? And this is precisely what Unitate does. We are in a bridge between the upstream and the downstream, between the world of the cloud, inventing academia, pharma, PDPs, scientists, inventing new innovations, and the reality, the ones saving lives, starting by the countries, but also the big funders like the Fund and Gavi and PEPFAR and the big bilaterals, NGOs, civil society, the people working in the field, preventing, testing, and treating patients. How do we do that? We try to overcome barriers. If a new product is ending the phase 3 research and development phase, they will need to transform that new innovation, that new treatment, for example, into a treatment being used by doctors in the field. And for that, you have to conduct operational research and then issue the guidelines. WHO will have to do that and recommend it to countries, and then we will have to register it in the countries, and then we will have to deal with IP issues, and then we will have to negotiate with the pharma and try to make the MPP attractive for the originators, putting their the patents available for the genericers to fabricate it, and then try to forecast to get a sense of how many, when, and how these new treatments will be used, which will determine the price, and then try to advance market commitments so we can take the price down and the countries actually can include it, and the institutional work at the same time with the governments for them including these new innovations in their national plans. So it's a multifaceted, multi-angle work we have to perform with the players in the upstream, trying to scan what is coming, what is new, what is available, what is potentially something we can use, and at the same time, a scanner and trying to get the gaps and where innovation is required for connecting this offer of innovation in the upstream with a demand of innovation in the downstream. It's a super complex work that requires a super agile, innovative way of interacting with people and interacting with different actors. And that is the challenge for a small speedboat among the aircraft carriers of the response. How do we do it? We do it dialoguing and generating platforms of consensus and interaction with people. And that is probably the main the most difficult part of the innovation I would like to comment today to end this short presentation, is how do we innovate in the way we interact here among each other? How How do we do for the Global Fund, Gavi, Unitate, becoming the same at some point? The response is one. We don't need different agencies competing for securing the funding, trying to complement each other. We should be the same. It should be a holding with different arms, with WHO. It's the time for integrating efforts and taking seriously the step of unifying the response, recognizing that we have different arms, but at the three levels. The first one, in terms of strategy, really compatibilizing the different strategies at the level of the governance, being more coherent at the board level, and then the most difficult one at the operational level. How do we do to our teams working together with the countries to secure this articulation that is hugely required for making innovation a reality? Thanks.